Hey, how are you guys doing? Hey, good to see you. Well, it's great to be in Ponte Vedra Beach and at Publix, no less, where I can tell you, we used to live right around the corner. My wife and I bought an awful lot of diapers from this store right here, one with Madison and Mason, and so we've been longtime customers, and they've done a great job. You know, they knocked this down a few years ago and then built a whole new one back up. So it's amazing how time flies. But we really appreciate being here at Sawgrass Village Publix. I want to thank Dane Russ, the VP of Pharmacy for Publix, for being here with me for another great announcement. Now, last week we announced the launch of a new public-private partnership between Publix and the state of Florida. We had 23 pharmacies in Citrus, Hernando, and Marion County that were open for COVID-19 vaccinations. And seniors could go on, make an appointment, and they're doing between 100 and 125 shots at each store every day. And I was able to go with Dane and with some of the other Publix folks, including the CEO, Todd Jones, who's doing a great job. We went, I visited 3 or 4 stores. I talked with folks, 100% approval from the seniors who were there getting shots. Everyone was happy. They really did a great job. And so, you know, at the end of the day, we have hospitals doing a lot of vaccinations. We've got some of these community sites, drive-in, and that's all good. But Publix is in every community. If we can get it more in every community, it's going to be easier for people to get the vaccines. And so yesterday we announced that we are expanding to the Panhandle, 26 additional Publix pharmacies in Northwest Florida in Escambia, Santa Rosa, Okaloosa, Walton, and Bay counties. And so they're going to be able to sign up today, and you're going to start to see shots tomorrow in those counties. But that's not all, and that's why we're here. So today I'm happy to report that we're expanding it even further. We're doing 56 additional Publix pharmacies here in St. John's, Flagler, Volusia, and then down in Southwest Florida in Collier County. So we're going to have 14 Publix in St. John's, including the one right here in Ponte Vedra Beach. There'll be 4 Publix in Flagler County, 22 in Volusia County, and then 16 in Collier County. And I've just spoken with the Publix folks. We're not stopping here. As you probably heard in the news, they're talking about maybe releasing more vaccines sooner. We have the ability to do it. Publix has the ability to do it, and we want to continue following the models that work. So right now, today, they are going to have the site live for appointments for those Publixes in those counties. So Publix.com/COVID vaccine. There'll be a link. You can go, reserve a time, and the appointments go very quickly, so just be forewarned about that. But once they're out of appointments, that's just out of appointments for whatever shipment they're getting. They're going to be opening them up to do more in the future, and so hang in there. We have now done in the state of Florida, well, there's been reported close to 400,000 seniors have received vaccines in Florida. That's the most of any state by a country mile, and that's just what's being reported. We're the only state that's done a majority of our vaccines for seniors, and we've done now 60% of all reported shots have gone to people 65 and up, and that percentage is going to increase each week. And if you look, when these shots are reported, it's not instantaneous. So for example, last Wednesday, we now show 68,000 shots done in one day. But if you would have looked at that a day after, 2 days after last week, it would have been like 45 or 50,000. So yesterday, they're already reporting 38,000. I can tell you that is going to go up significantly as the shots are being reported. But we really believe it's important to put seniors first on this. You remember when we did the vaccine strategy, I did not follow the federal government saying to put healthy workers ahead of senior citizens. And the reason is because that's not consistent with the data that we have that shows the risk is more significant as you get older. And so we made the decision that obviously as the nursing home mission went from the very beginning, and that's continuing, as the healthcare workers who are dealing with COVID patients in particular were getting vaccinated, we made the decision that our next goal was 65 plus, seniors first in our broader community. Now we knew that there'd be way more demand than you could meet supply. But we would rather have there be more demand than supply than having the vaccine go bad like you've seen in other parts of the country. So the demand is robust. People are getting shots. We're going to continue to have more and more throughput as more vaccine comes. But I think it's important to note that we didn't follow that. We put seniors first. Now what is the federal government saying? They're saying to do 65 and up, just like Florida has done. So we've led the way on this, just like we led the way with opening schools, just like we led the way with putting people back to work, just like we led the way with protecting nursing homes at the outset of this. 65 plus is where we need to focus it. And if you look, to be close to 400,000, and we're still in the second week of January, and that really increasing at a big clip every day. We're just really excited. And I can tell you, being at all these events where we've seen people in Publix, we've seen people at I was at the Villages yesterday, drive-through test site or drive-through vaccine site. We wanted it to be golf carts, but it's too cold for their golf carts. So now they're doing their cars. But if it warms up, they'll do golf carts. So you're doing that. And, you know, in the hospitals, people going in. And this is a sense of relief for a lot of people who have been waiting for this for a long time. And I can tell you, the sense of relief that a 73-year-old gets from this is not the same as if you vaccinate a 20-year-old healthy worker somewhere. So we're putting our parents first, our grandparents first. The momentum is building. We're going to continue to do it. Publix is a really, really big part of that. So again, those four counties, St. John's, Flagler, Volusia, and Collier, you're going to be able to make appointments starting today, and you're going to be able to have shots available in all these Publix starting tomorrow. 105 Publix overall so far in the program. They've got over 750 of these statewide. So believe me, as we get more vaccine, you want it to be in some other counties, you'll do it. Some people ask why you're doing some of the counties we're doing. You know, there's some counties that have really big healthcare infrastructure. I mean, Miami-Dade, they're doing a lot. Orlando, Jacksonville has a big infrastructure, a lot of hospitals. We looked at counties that may be a little more medium-sized that have a lot of elderly people as a percentage. And so Hernando, Ocala, or excuse me, Marion, Hernando, and Citrus, and then the Panhandle, and now these counties that we're doing now are really, I think, way to get it to the demographic we want and boost numbers in counties that maybe didn't have as much vaccine prevalent as you've seen in some of these other parts. But we're not stopping here. We view this as something that we're going to continue to do. So if you look at what's the picture in the state of Florida, we have over 70 community vaccination sites now with the state, the county health departments, a lot of county governments. The hospitals, many hospitals are doing a really great job. You know, they're doing thousands of shots a day in some of these big hospital systems. We also have some major vaccine sites like Hard Rock Stadium in Miami. That's a big testing site. Now we've started doing vaccines there, and we're doing over 1,000 a day there, and may look to expand it if we have more vaccine, and even kept it open for the national championship game. Had to close it a little earlier, but we didn't want it to go down, so we did that. And then we're also working with places of worship to be able to bring vaccine to folks. And so on Sunday, I was in Bay County, but we had it all over the state, partnering with a lot of churches to get senior citizens vaccinated. And so the decision's going to come now if the guidance does change about you can use. So right now, if I get 250,000 doses, they're holding another 250,000 for the booster shot. They're now saying, you know, maybe you're not going to hold all that in advance because we're confident production is going to continue and you're going to be able to get the booster shot. So let me just say one thing. Whatever anyone says, Florida's committed to the booster shot. We think you need both shots for Pfizer and Moderna to reach the 95% efficacy. And so we are going to stand with that. We want people to get their booster shots. No one that's gotten an initial shot now, the booster shot has been held in reserve. If they then change the policy, I may get 500,000 shots. And so the question is, I'll have the boosters for everyone who's already had shots. Then we have to make sure in 4 weeks, if you're talking about Moderna, that you're able to make sure everyone has the boosters. I think that the production is going to be there, but we're going to work on exactly how we want to approach that. We'll make an announcement on that soon, but that'll be able to increase the shots that are happening every day. We almost hit 70,000 last Wednesday. We were over 60,000 a day 3 days last week. I'd imagine when these numbers are fully populated for this week, we'll be well over 60,000 both Monday and Tuesday. And if we put more, people like Publix at work, I think we can make that go even more. But when we get 250,000 shots in a week, that is definitely being eaten up at this point. There's no question about it. So that's going to be something that we're going to be looking at, and that's going to be something we're going to do. But our goal is putting seniors first. Our goal is to offer it to every senior who wants it. And for those who may not get an appointment with Publix today or may not be able to get in this round, hang in there. You're going to get it. This is like more demand than the iPhone, new iPhones. I mean, it's crazy how much demand. Like the phone lines will just melt, the websites, it's unbelievable. But just understand, when we're doing tens of thousands of seniors every day, that softens the demand. There'll be more and more availability. And so if it's not today, we're going to do it, and we're not going to stop. So if you haven't been able to get an appointment yet, if maybe you're in a county where the Publix isn't doing it yet, maybe just for whatever reason, hang in there. We're not stopping. We got 4.5 million seniors in Florida. We've done more seniors than anyone, but we've got a long way to keep going. And trust us, we are not going to stop until everyone gets it. Thank you. Thank you. Yes, ma'am. Anybody?
Governor
Yep.
DeSantis alluded to actually Jack. I know you mentioned that appointments start here in St. Johns County as well as the other three counties for Publix. I mean, how does that process work? What time do folks actually have to sign up to make sure that they get it?
So the website is going to be live as we speak, and so that website is publix.com/COVID vaccine. There'll be a link there. You can go make it, and basically they're going to do appointments, I think, for as many days as they have vaccine that we've allocated to them. But we're going to keep allocating more. So as soon as we allocate more, when we get next week's shipment, then they're going to expand and they'll put it out some more. So we view, like we told them, we want to continue doing what works. And, I think there's been a lot of success on a lot of things. There have been some partners we've worked with that have done okay, and then there's some that have gone above, like Publix, and really, I think, served the seniors' needs. And so we're going to keep doing it.
Governor, we're not trying to get worried with you. When are you going to do more vaccination sites opening in minority underserved communities? Like you mentioned, the health insurance. We saw that 7 places throughout the state. And I also
Well, we've actually done, so we started in Pensacola the previous week. We expanded it across the state. We're going to continue to work. So in Bay County, we're going to do some follow-up, as we get more vaccine, be able to do it. So, it's important that not only we get it all across the state, but, getting it into the places of worship, you have people that are trustworthy, the pastors people trust, and they're able to help really, I think, organize a lot of folks to want to come. There's not 100% interest in the vaccine, and most people, I think, want it. But even like you look at our hospitals, there's some hospital systems that had 75% of their nurses opt for it. There's others that had a third opt for it. And so you just see. So what we want to just say is, look, we want to make it available, and we don't want misinformation. I mean, if you just don't want to do it, fine. But if people you trust have taken it, tell you it's good, then maybe that'll cause you to want to take it. Well, I mean, the timeline is, we're getting more and more vaccine. I think it's just a matter of, we distributed a bunch of doses to that. If I had twice as many doses, we would have done twice as many sites. I mean, that's just the way it is.
Governor, any word on when this may happen in Duval County? There's lots of questions about that, Jacksonville being such a large area. So any word on when this may happen?
So if we get enough vaccine, we want to expand it everywhere with the Publix partnership. I think the thing that separates like a Duval from a Flagler or Collier is just Duval has a really strong hospital system. You got many hospitals. A lot of them have gotten doses. I know people have gotten shots at a bunch of these different places. And so some of the other counties that we've gone to a little bit more medium-sized, heavy senior population, we saw a gap there that we could really get the shots up right now. But yeah, our goal would be, let's do it everywhere. Now, they have 750 stores, so if we did it everywhere, you can do the math. You need hundreds of thousands of doses just to Publix they'd run out in 4 or 5 days on that clip that they're doing with 100 and 125. But we want to do it. We told them use it, get it done, and then we'll fight to get more. But we don't want it sitting on the shelves. So we told a lot of hospitals have done well and they've asked for more. Others who still had some, they're working to get it out and get the shots in people's arms.
Governor, if you want to get a shot in St. Johns County at the store, you have to live in St. Johns County.
No, and the reason is because they have stores that are right on county borders, and those are their customers. What we are saying, though, and it may be a little bit here, but more so in the Panhandle, this really is for Floridians, though. I know, if you live in Mobile, Alabama, maybe you want to come to Pensacola. Well, we're doing it for Floridians, and that's how we want to do. Now, obviously, we have some people that only live here half the year. That's fine. But if you're kind of a permanent resident in these neighboring states, we do want it for Floridians. I don't think you're going to police the different county stuff, but obviously it's easier for folks to get to Publixes that are close to them.
Will it be coming to CVS and Walgreens and other pharmacies?
So, last question. So questions about CVS and Walgreens. So what CVS and Walgreens are doing are the nursing homes. So they were contracted with the federal government to do that. And let's just say that I have to put it where I know it's going to go quickly, and I think Publix has proven to be the best at that. So I think what we would do if we had more vaccine dumped is just get it to more Publixes as probably the way that we think makes the most sense. And because that long-term care mission is still ongoing. I mean,
That's a no to CVS and Walgreens.
I would say that they have a mission with the long-term care, and we'd like to see that mission completed. And that's and I've had, last week I announced I had to surge additional personnel from the state to do some of the assisted living facilities because we wanted to get it done, and we didn't want it to languish anymore. So that's what we're going to do. We're going to focus. We're going to, we want obviously them to follow through on the nursing home stuff, and we're going to help out with the assisted living. But as that mission's going on, we're going to continue to work with hospitals, health departments, places like Publix to be able to get the vaccine to the people that need it. And that, again, is seniors first. People will ask me, what about this? What about that? There's a lot of folks who are great people in Florida. There's a lot of folks that do great, important work. And this is not anything about, but when you put seniors first, you're doing the right thing in terms of the evidence and the data about this virus. And these are the folks that have had it the worst in terms of having to do mitigation and be concerned about it. So the quicker we can relieve that burden off our seniors, let me tell you, everything else will be able to be very manageable. And just think about from the perspective of family, of economy, it's the right thing to do. So we're going to get through the seniors. I know I want to give it to police departments, all these other places, but we're going to get through our seniors first. And when we do that, then you're going to start to see it into the broader population. But we're not going to rest until every senior gets it who wants it. Thanks, guys. Thank you. Good to see you guys. Yep, thank you. Thank you. Thank you.
Go Navy. Welcome home.
Yeah, I know.